Morning, everyone. How's it going? Happy Wednesday. All right, so we're going ahead and we'll go and get started in just a second. Make sure that someone does, I'm going to pull it up on my phone here too, so I can see if any questions come through while we're going through this workshop. If you guys do have questions, go ahead and just put those in the comments. Okay. All right. So we're going to get started. You guys are able to see okay? If not, there's kind of a glare. Let's see if we can move this over just a tad bit. If that works. Let's see if that's any better. All right. Okay, guys. So my name is Ben. I'm a physical therapist with Pro+Kinetix Physical Therapy and Performance. We specialize in helping people that are active get back to workouts and sports they enjoy without medications, injections, or surgery. So we specialize in helping people that are CrossFit athletes, people that are running, that want to be running marathons, 5Ks, half marathons, climbers, just people that are just in general workout and are active and just having a little bit of difficulty doing that. So that's where we come in and help people with that. So today we're going to be going over squat mobility. Okay, this is something that is super important because it's very functional. We squat every day, right? Maybe not in the gym or anything like that, but when we go to sit down in a chair, come back up, that's a squatting motion. All right. And so a lot of times when we don't have proper mobility to achieve the squat, we start having pain. There starts to be breakdowns where we start seeing knee pain, low back pain, hip pain, stuff like that. So today you guys are going to be able to learn a few self-assessments to figure out where is your mobility lacking, if that's the case. And if that is the case, then we're going to address that. I'm going to give you guys a few exercises to help with that. So we're going to go over just some general things with regards to the squat. So with regards to the squat, when we have to have mobility at the ankle, the knee, and the hip. If we're not getting mobility at the knee, ankle, or hip, then we're going to start seeing compensations occur. So if we don't have enough ankle range of motion, that means we have to have increased knee range of motion and then also increased hip range of motion. Okay? If we don't have that, then our mechanics and our biomechanics of our squat pattern is going to change. And when that starts changing, when the biomechanics start changing, then we're going to start seeing inefficiencies with our squats, and we're going to see compensations, which can lead to injury and pain as well. So that's the big thing that we need to make sure that we've got the adequate mobility. All right. Usually everybody does okay with knee mobility. Where I see most issues are the ankles and the hips. Okay, and that's because a lot of times people are sitting so much throughout the day. These ankles get tight, and so do these hips, and those are all very important things when it comes to the squat. So today we are going to go over how to assess the ankle and then how to also assess the hip, so you guys can figure out where your restrictions are coming from. So then once we identify what's restricted, then we can start going into some exercises to start correcting that for the ankle and then also for the hip. All right. A lot of times when people have pain with squats, it's usually in the knee. All right. But today we're only going to address the ankle and the hip because those are usually what's responsible for the knee pain. Okay. Rarely is the knee actually responsible for the pain that's having. It's usually coming below that joint or above that joint. Okay. So let's go ahead and we're going to go ahead and take a look and assess the ankles. So what I'm going to do is I'm going to turn this around here. All right, so what I need you guys to do is go ahead and find a wall space. Okay. And what we're going to do is we're going to see how much ankle range motion we have. All right. So what we want to do is we want to take this knee. Doesn't matter what this back leg's doing. Don't worry about this. Whatever's most comfortable to help you stay upright and not fall over. All right. So what we're going to do is we're going to take our toes, bring it up to the wall. All right. And then from there, we're going to try and take that knee and touch the wall. Okay. You guys should all be able to do that. Then if you're able to do that, what you're gonna do is you're gonna scoot your foot back about an inch and do the same thing. All right, don't let that heel come up. And then we're just gonna go inch by inch until we start seeing where our limitations are and when we start seeing that heel lift up. We also don't want the knee to come in like this, okay? We wanna make sure that knee is going directly over that big toe, okay? And then we're just gonna go back and forth until we start running out of range of motion. Okay, so this right here is about where you guys can see my heel starting to lift up a little bit. Okay, that tells me I'm out of my end range. So I'm at like about 4.5 inches there, okay? So what I want you guys to do is go ahead and try both sides there, okay? Try the left and also the right side and see if you're noticing any asymmetries, okay? I'll tell you what, before I tell you guys what the normals are, I want you to go through this so you can't cheat, all right? But take a mental note of what you are on the left side and the right side with regards to how far away you are from the wall, and I'll give the norms on what we need to see with that. With regards to asymmetry, the research shows that we're actually better off having two equally bad ankles than one that's good and one that's bad. Okay. So if you guys have any questions about this, put that in the comments. I'm gonna grab my phone so I can see those comments while you guys finish up there, and then we're gonna go over what the norms are, and then also go over some exercises to correct that. Okay. All right. So I don't see any questions. Good. Let's see here. All right. So you guys should be about done. So what we're gonna do is discuss what the normal ranges are. So the research says that for us to have adequate normal walking pattern or gait pattern, we need to have at least 3 inches away from that wall. Okay. If we don't have that adequate range of motion in the ankle of that 3 inches, we're gonna start seeing compensations for that. So if you see somebody that walks with their toes kind of pointed out like this, okay, that's most likely can be hip or ankle, but a lot of times it's ankle, okay? So we turn our feet out when we lack the range of motion here, okay? For us to advance over the foot, this back foot has to have good dorsiflexion, or that test that we did, good ankle mobility. If it doesn't, then we're gonna start compensating and start turning our toes out, okay? So we just start making compensations if we don't have that 3 inches. That's just for normal walking pattern, okay? Everyday life. For people that are squatting and running a lot, we ideally want around 5 inches, 4 to 5 inches with that, okay? If we don't have that, especially when we go deeper into a squat, we definitely need that 4 to 5 inches, okay? The deeper we go into the squat, the more our shins have to be translating forward. If we don't have that, then we're gonna start seeing those compensations in the hips and the knee joint as well, okay? Any questions on that? Okay, so if you're not, and then also we talked about asymmetries. I'm sure a lot of you guys had asymmetries. Okay, so a question I get a lot is like, oh, my right one was only 2 inches and my left was 4. Should I only focus on that right leg and only do stretches on that side? No, don't do that. Make sure you're doing it on both sides equally, because before you know it, that bad side is going to become the good side, and then you're just playing a catch-up game, you know, of trying to catch the left leg up to the right leg up to the left. If you just do them equally, eventually that one will catch up to it, and then you'll be even throughout the duration of that, okay? So let's go ahead and we're gonna get into some of the stretches and exercise you can do to improve that ankle mobility, okay? So let's go ahead. I'm gonna move this up just a tad bit, okay? So what we wanna do is, again, you guys can just use the wall that you're at, okay? And what you're gonna do is that it doesn't matter what this front leg's doing now, okay? Just as long as you're stabilizing yourself, what we're doing is we're trying to stretch this back leg, all right? So just so you guys have some context to this, there's 2 calf muscles, all right? There we have the gastroc, and then we have the soleus, okay? The gastroc attaches above the knee joint, the soleus attaches below the knee joint. So we can actually target each muscle individually. And this is where I see a lot of people mess up. I have a lot of people come in where they're like, I just work on my ankle mobility all day in and day out and it doesn't change. And I ask them to show me what they're doing and they show me just one stretch, all right? And usually it's just for the gastroc muscle, but they're missing the other half of the calf muscle, all right? So they've missed out on 50% of that. And once we loosen up and I show them this other exercise to target, then it frees that other muscle up, and then they start making their changes that they wanted to see with ankle mobility. That's why it's so important to do assessment and figure out where your restrictions are, and not just throw, try and be like, a lot of times people just don't know where the problem actually is. Okay, we talked about how a lot of times that knee pain the knee isn't responsible for the knee pain. It's usually the hip and the ankle. So it's important to figure out where is the problem, okay? And once you figure out that problem, you don't want to just start throwing random exercises at it. You want ones that are tailored to you and your individual body. So it's important to know which ones are going to be effective with that too, okay? So we're going to get into, I'm going to show you guys the gastroc stretch, okay? So what we want to do is we're going to keep this back leg straight, okay? And then we are going to be leaning in and kind of pushing against the wall, and we should feel a good stretch in the calf muscle right here, okay? And again, make sure to keep that back leg straight, all right? And ideally, we're holding this for about 30 seconds, okay? And then once 30 seconds is up, you obviously want to do the same thing on the other side, okay? So I'm gonna let you guys finish that up there, okay? And I'm gonna kind of talk a little bit. All right, so ideally for stretching, you want to be doing 3 sets of 30 seconds, okay? And you want to be doing that multiple times throughout the day, ideally twice, okay? If you can only get through once, that's okay, all right? But ideally twice. Okay? The regards to why we hold for 30 seconds, that's just what the research tells us is the best, all right? They did tests where they did 10-second holds, 20-second holds, 30-second holds, a minute, 2 minutes, 5 minutes, and 10 minutes, and they found that the 30 seconds is the biggest bang for your time. Do you get improved stretching with holding for 5 minutes? Yes, but who actually has time to be holding stretches for 5 minutes each time? All right, so 30 seconds, 3 sets is ideal with that, okay? So again, that stretch you should have felt that a little bit higher in the calf, all right? So that was the gastroc. Now we want to go up to that soleus muscle. That muscle's deeper underneath that gastroc, and this is one where I see most people don't effectively target. All right. So what you're going to do is, instead of keeping that back leg straight, we are going to try and drive that knee down into the floor. Okay. So what we're doing is we're trying to take this back leg, it's straight on that last one. Now we're trying to bend that knee, okay, and drive it to the floor. And we should start feeling more of a stretch in the lower portion of the calf instead of higher up in the gastroc. Okay. And we're just holding that for about 30 seconds. Okay. Some of you may feel a bony block or kind of like a pinch in the front of the ankle. That can be a totally different issue or restriction. We're not going to get into that today because it's a little bit more uncommon. I want to make sure that we target the muscles that are usually most tight. Okay. So if you have that issue, you can just message me and let me know, and I can send over an exercise to address that pinching in the front, okay? And then also, with regards to, you guys can also make this more aggressive if you have the stair. So I'm gonna use the step here. So what you can do is you can use the step and make it a little bit more aggressive, okay? Where you can just hang off your ankle or your heel like this, okay? Keep that leg straight. If you keep that leg straight, it's going to be going after that gastroc. Okay, if you bend that knee, you're going to be going after that soleus. Okay, so that's another way you can do it. You can use the wall or you can use the stairs. Stairs can be a little bit more aggressive. Okay, and then of course, if any of these are painful, stop. All right, none of these should be painful. It just means your body needs something different. Okay, so those are the two best stretches for the ankle mobility. We're going to also go over foam rolling for that. Okay, the best way to loosen up muscles is a combination of stretching and foam rolling. Okay, so let's go ahead and we'll get into that. Let's see if we can get this set up here. My glare's kind of there. Okay, so you can take a foam roller, and what you're going to do is you're going to place this underneath the calf. All right, and then we are just going to roll up and down the entirety of that calf. Make sure you're going all the way down to the heel, okay, and then all the way up to the knee joint with that, okay? And then one thing too that I see a lot of people mess up is they only point the toes directly straight ahead or straight up. All right, that calf muscle wraps all the way around that to the front of the shin. So we need to make sure we're also angling our toes out, okay, and hitting the outer parts of the calf, and then also turning them in like this, okay? And ideally we're doing 2 minutes each leg. Okay, if you want to make this more aggressive, you can cross it over. Okay, you're adding more weight to it to maybe be more intense. And so like right now, I kind of have a knot in my right calf. So what I'm going to do is I'm going to pause and hold out down on that. What I'm going to do is I'm going to take my toe, my foot, bring it up, and then I'm going to push down and bring it up and then push down. And just do about 10 reps of that. And what that's doing is it's pinning down on that tight muscle. All right. And then while it's pinning down on that foam roller, now as we move and flex our foot, we're bringing and rolling, or we're kind of moving that muscle over the top of the foam roller, and it's going to help loosen up any knots or muscles or tight areas that we have too. All right, so I'm going to let you guys go ahead and do 2 minutes there. Okay, I'm going to see if there's any questions. Again, if you guys have questions, go ahead and just put those in the comments. I'm going to move this over here so we get rid of this kind of glare. Okay, make sure you're bringing the toe, you're rotating the feet out, rotating the feet in. And this one might be kind of uncomfortable. Start with 2 feet at once, and then you can start moving towards 1. Okay. And then when we're done there, we're going to go ahead and move over into the hip and go over some stretches for that. So the testing for this, when it comes from a patient perspective, is I'm just going to have you guys do the stretches. And if you feel like there's quite a bit of restrictions and it feels pretty tight, that kind of is your assessment as well. And then if you feel a difference between left to right, that's going to be a good indicator that there's obviously some imbalances. There's some physical therapy orthopedic assessments that we do as physical therapists. But again, we're trained in doing that. It's going to be hard. It's hard for a patient to be able to assess it. All right. So we're going to use the stretches as our assessment. So what we're going to do is we're going to lay it on our back. And what we're going to do is we're going to cross this right leg over our left. And then what we're going to do is we're going to take this knee and drive it to our opposite shoulder. Okay, so right now I have the right knee over the left. We're going to take that right knee and drive it to the left shoulder. And we should feel a pretty good stretch right in the glute area. Again, we're just going to hold this for 30 seconds. So this muscle that we're stretching here is called the piriformis muscle. So I'm sure a lot of you have heard of the term sciatica. So sciatica is can be coming from the back, or it can be coming from a tight glute muscle or the tight piriformis. So that sciatic nerve travels underneath the piriformis, the muscle that we're stretching now. If that piriformis gets really tight, it can compress down on that sciatic nerve and cause pain down the back of the leg and sometimes even all the way into the foot. Okay. And so you're probably wondering, well, why does the piriformis get so darn tight in the first place, or why are people more prone to that? So the reason for that is that piriformis is a pretty small muscle. It's not supposed to be doing a whole lot of work, right? But it will if we have muscles that aren't doing their job, such as the bigger glute muscles, the glute medius the glute maximus and medius. If those big glute muscles aren't doing their jobs, then that piriformis starts getting overworked and having to take over the work of the lazy glute muscles. And then when that happens, and when muscles get overworked, that muscle gets tight, and then when it gets tight, it can generate pain. Okay, let's go and switch and do the same thing other side. Okay, and then we are going to take this left knee and bring it to our right shoulder. Okay, and again, hold this for about 30 seconds. Should be feeling kind of in this glute area. So be careful and be aware of whether you're feeling more tightness on the left or the right, or right over the left. This can also be influenced by if you cross one leg over the other more than the other. That can play a factor into things. But back to the piriformis. So I'll see a lot of people that have this piriformis pain or lack hip mobility, and what they do is they just stretch every single day, and it keeps it at bay. Don't get me wrong; it does make it feel better, but they have to keep doing it day in and day out because it just keeps getting tighter again. You're better off not just, in my opinion, that's just treating the symptoms. You're not treating the root cause. The root cause is the glute weakness. It's much easier to maintain strength than it is to maintain mobility. All right. So if our joints and our muscles aren't getting the stability that it needs, it's going to start compensating in other ways and recruiting other muscles that aren't supposed to be doing their job. All right. And then these muscles get tight. So you're better off strengthening and figuring out where your weaknesses are and strengthening those up. And then this piriformis wouldn't get so darn tight. And then you wouldn't have to stretch it, day in and day out, because now you're finally addressing the root cause. Okay. So that's where I see a lot of patients that come in and they're like, I stretch and it feels better and I have my mobility routine, but it just keeps coming back. And again, it's just because they're just treating the symptoms. Okay. All right. So any questions on these two at all? Okay. So now we're going to do, instead of going from opposite, bringing that knee to the opposite shoulder, we're going to actually push away. Okay. To open up the hips. We're going to hold this for about 30 seconds. This is going to feel like a totally different stretch. You shouldn't really be feeling it in that glute area. Might be a little bit more in the groin or feel a little bit deeper into the joint. And I'm going to explain the importance of these in just a second and why these are going to also improve your hip mobility, or sorry, not just your hip mobility, but your squat mobility and your ability to get deeper into the squat. So usually hip mobility, if we're lacking there, we get compensation from the low back. Okay? So I had a patient that came in and stated that they had been to physical therapy for 6 months and that they weren't really seeing much improvements. And I'm like, well, what did they give you for a diagnosis? And this person said that they had a weak core. I'm like, okay, what are you having pain with? And they said, I'm just having pain with squatting. I'm like, okay, how much are you squatting? They're like 300 pounds. I'm like, okay, so if somebody's able to squat 300 pounds, most likely it's not really a core weakness issue. Okay, but I didn't want to just jump to that conclusion. You can still have muscle and coordination at the core. But the fact was he just had pain with squatting. All right. So it's most likely pain or squatting that was causing his pain, right? Seems like pretty logical. Well, I asked this patient, did the PT assess your squat? And they're like, no, they never looked at my squat. We just worked on core strengthening the whole time. And so I'm like, okay, show me your squat. And what I saw was, I'm gonna have you guys go and switch to the other side. What I saw was this rounding of this low back, okay? And when he got into a deeper squat, we started seeing rounding of the low back. And while you guys are doing that, I'm going to kind of explain this a little bit so you guys can see. So when we do a squat, okay, or when we have normal spinal position, you guys can see my low back kind of has a little bit of an arch to it. Everybody's does. We all have like a natural curvature to our spine. When we go into a squat position, we want to maintain that same neutral spine alignment throughout the entirety of the squat. Okay. So what he was doing was called a butt wink. Okay. A butt wink is when we start. So I want you guys to watch my spine the entire time. And so what he was doing is, all right, so his low back, my low back looks good. Now when I get deeper into the squat, you guys see how my low back's kind of rounding out now? Okay, I've got rounding here. Okay, that's what happens. That's the butt wink. Okay, this is what a butt wink is. We go down and we start rounding out at this low back. Okay, so when we round out that low back, we can irritate the disc. Okay, there's fluid-filled sacs in between the vertebrae, and when we start bending and over flexing, especially when we've got weight on our back, it can push that disc back and hit nerves and cause pain. Okay, so why does that happen? Why does our low back start rounding out? Is it a lack of core strength? Usually no. Majority of the time, no. It's our hips and our ankles have started running out of range of motion. Okay, and so when we run out of range of motion here, now this low back, for us to get deeper into squat, has to start rounding out to compensate for that. Okay, and we start having pain. So his low back pain, again, was not just like the knee's not usually responsible for its pain. It's usually above or below the joint. Same thing with the low back, okay, especially with squats. Okay, his issue was hip mobility majority, but he also had ankle mobility as well. We talked about how everything's connected, right? And if we don't have ankle mobility, we have to have compensation from the knee and the hip, right? He did have a little bit of ankle restriction, okay, but his main thing was hip, all right? And so when we lose ankle range of motion, that means we have to have even more from the hip, and he did not have that. So guess what happened? It worked its way up the chain, and now the low back is compensating for things. Okay, so guess what we did? We attacked his hips, and each week he was able to still keep squatting. That's the thing, is there's always modifications. All right, I'm never going to tell somebody to stop working out or stop doing a certain activity. There's always modifications we can do to keep you working out and keep you moving. Okay, so let's see here. I think we may have lost the live feed here. We'll see if it comes back. Anyways, like I was saying, we attack the hips. Okay, we're not going to restrict somebody from working out. There's so many modifications we can make. All right, so we attack the hips. He was able to get deeper into squat week in and week out, and then we also addressed the ankles, and he was able to squat pain-free over, and he also increased his weight that he was able to squat. He was able to squat 300 pounds. He went up to 335 in just a couple weeks. Right, and that's because we were able to fix his biomechanics of the weight he was squatting, and then we were able to increase his weight. Okay, so those 3 exercises for the ankle and those 2 for the hip are going to help improve your ability to improve your squat mobility. All right, if you guys want a copy of this routine instead of like trying to memorize it or know if you're doing it correctly, just message me through Facebook. Okay, and I will go ahead and send that over to you guys. You can also find us at Pro+Kinetix Physical Therapy and Performance on Google. We're located in Uptown Oakland, so you guys can find our contact information there. If you're interested in contacting us for that mobility routine, and then we're also doing, because you came to this mobility class, we're offering 50% off initial evaluation. We're still seeing patients in person as well as virtually, and so if you're interested in that assessment, that 50% off is good for today only. But yeah, hope if you guys have any other questions, just go ahead and put those in there, and I'll do my best to answer them real quick. I'm not seeing any right now. Okay, so yeah, if you guys want the mobility routine, just let me know. Otherwise, I hope you guys have a great Wednesday. All right, and stay safe and healthy, and keep moving and keep exercising. All right, bye guys.